Okay, Dr. Adam Miller here from Arise MD. Dr. Sahar Swidan, good to see you again. Healing High Fives.
Always.
We're here in Ann Arbor, Michigan at Pharmacy Solutions, and I know that many of you have probably already heard of or seen you speak somewhere in the world involved with A4M. You and I first met through the A4M, the American Academy of Anti-Aging Medicine.
10 years ago now, we're aging.
Yeah, the world of compounding pharmacy continues to evolve, and I think the role of the compounding pharmacist, Sahar, in this new era of medicine is becoming more and more important. Stay with that for a second, because one of the things that you've taught me about is LDN. Mm-hmm. And just talk for a second about what it means to use low-dose naltrexone and the different delivery mechanisms and why you choose one over the other. And what are some of the wow cases that you're hearing or seeing?
Yeah, so it's interesting. So low-dose naltrexone, so everybody probably, you've heard of naltrexone. So that's a drug that's been on the market for over, 30 years now, when we use it for heroin and alcohol addiction, right? But that's very different. So high dose naltrexone, which is what I just discussed, is used for, heroin addiction, methadone addiction, and alcoholism. Low dose naltrexone is very different. So discovered really by Dr. Bahari out of Harvard, in the 1960s. And what he found is when he used these tiny pixie dust doses, as I call it, of naltrexone, and the doses that we're discussing here, and also what was studied really in the major clinical trials, is 1.5 up to 4.5 milligrams. So much tinier than the typical dose of this drug, which is 25 to 50 milligrams 3 times a day. So the dose is about 1.5 milligrams up to 4.5 milligrams, usually given once nightly at bedtime. And what he found is that it caused huge regulation of the immune system. So initially they really looked at it for inflammatory bowel disease, so ulcerative colitis and Crohn's disease were the initial studies. And then Dr. Bihari actually tested them in AIDS patients, and then in AIDS patient what he found is their immune suppression dramatically improved, and their immune system responded dramatically and functioned much better.
For reasons that aren't clear yet.
Yeah.
Is it?
Well, so I think we know a little bit. So, a lot of people think that really low-dose naltrexone is an immunostimulant, but it's not. The problem is our immune system is so dysregulated now because we live in such a toxic, I call it, we swim in a bath of toxins every day, from environmental toxins to work toxins to food, environmental, the pesticides, the herbicides, all the toxins in the environment, EMF, electromagnetic frequency, from cell phones, from our Wi-Fi's, and, we're frying our DNA and brains all day long with this stuff. I always tease, including myself, we're paying such a high price for convenience now, right? Nobody,
well said.
Our bodies, let's rephrase that. Our bodies are paying such a high price for the convenience of what become an Uberized society, right? Everything, we want Uber to deliver everything, including our brain, our nutrients, So the problem is our immune system is getting hit with so much more. And so we have really almost everybody has immune dysregulation of some sort. And that's why autoimmune disorders are skyrocketing. It's such an epidemic, literally, proportion. And so what's nice about low-dose naltrexone, and sometimes I tease that I think we should just put it in the water, is because everybody has some level of immune dysregulation. So what we call Th1 and Th2 in mast cell, which is histamine, that's the stuff that makes you itchy when it's released, or when you get exposed to like weed and rags or whatever, and ragweeds, and you're just sneezing your head off, that's histamine release causing that, right? So what low-dose naltrexone really, it rebalances that immune system. So we go from crazy autoimmune, I'm hyper vigilant, I want to attack everything, to like, okay, the world is okay, all is well. Let me just kind of rebalance that so your immune system is not so crazy and upregulated. And that's what they found. So now they've looked at the use of low-dose naltrexone in a variety of conditions. I mean, it's been tested in inflammatory bowel disease, like I mentioned, autism, chronic pain, fibromyalgia, multiple sclerosis, some cancers even. And the literature really continues to explode with the use of this. And the reason why, it's funny, pretty soon I think it's like the fish oil story. You could almost Google any disease with fish oil and find it to be effective.
Yeah.
And I think soon we're going to find that with low-dose naltrexone, where I think because it's I tease in medicine, I say we only have one medical specialty now. I call it inflammatology. And all chronic diseases really linked to inflammation, whether it's heart disease, it's neurodegenerative disorders, it's Alzheimer's, it's gut dysregulation, it's autoimmunity, it's high blood pressure, it's diabetes, it's cancer, you name it. And that's why it's so important to do an immune system check, if you will, to see what's hitting your system, what's dysregulating you. But low-dose naltrexone has been amazing for some patients. I mean, we've had some people, that were MS really severe that were able, to walk again, inflammatory bowel disease that were able to really, but it's not the panacea or the magic pill. It's really with the comprehensive body system approach, as I call it, where, it is proper diet. It is sealing the holes in your gut if you got leaky gut or permeable gut syndrome. It is, reducing stress, the epidemic of the 21st century, right? It's sleeping well. It's decreasing all the insults on your body. It's doing all the good stuff. It's exercise. It's breathing cleaner air. It's eating cleaner foods. And then low-dose naltrexone can be a great additional tool that we have now in our tool shed to really help some refractory patients with some amazing results.
What's the side effect profile like?
So, pretty benign, really on the spectrum, in the sense that most patients, sometimes it may cause some drowsiness or sedation. So we give it at night for two reasons. One is if it makes you sleepy, great. That will, you're sleeping anyways. But two, actually, because of your circadian rhythm, it tends to work much better because you make most of your happy hormones or endorphins, enkephalins, dynorphins, which is what LDN kind of tries to stimulate, which kind of has a positive effect on the immune system between 10 p.m. and midnight, kind of like when you secrete most of your acid, right? That's why sometimes these acid suppressors, we may give them at night for that reason. So that's the reason why you want to take it at night. So sleepiness and sedation. Another potential side effect is vivid dreams. Sometimes we'll hear that from patients. In some patients, it may paradoxically actually activate them. And we say to try it for a few nights. And if that doesn't go away, so we may switch them to take it during the day. Now, patients sometimes will go to the internet and read oh my God, liver damage, kidney damage, and they freak and go, oh my God, I'm not touching this stuff. But really that was mainly reported with high dose naltrexone, which is the doses that were used, again, for alcohol withdrawal, detox, that kind of stuff. It's not really has not been reported with low dose naltrexone. Now, can any drug cause any side effect? Of course, but that's why with providers we monitor all these parameters when any new medications are started.
Do you think that it can reset a person's immune system, or is it just modulating and therefore you probably, if you get a response, are going to need to be on it long term?
So that's an interesting question. So honestly, the answer is we don't know. The trials are definitely going. Now we have what I call anecdotal trials, right? We've had some patients that have been on it for years because they've responded so well, and they're like, hey, if something's working, don't rock the boat, right? So it's more clinical trench data, as I call it, more than some of the hard science and clinical trials. But a lot of those trials are actually ongoing now to look a different dosing regimen. It's very interesting, and we don't know, but I can tell you clinically in Lyme disease patients, for example, they tend to respond much better to 2 to 3 milligrams versus the 4.5. When we bring him up to the typical 4.5 that was in many clinical trials, they don't do as well. So now clinically, we learned from the trenches, and now we're doing the scientific studies, if you will, to go, do some patients maybe just need 1 milligram BID? Do Lyme disease patients need possibly lower, and why, is the question. Do we reset the immune system? Now, I can tell you, I do think if you do the correct stuff, remove the insults, clean up heavy metals, toxins, whatever is burdening your immune system or causing your dysregulation, bacteria, fungus, Lyme disease, mold exposure, all the stuff that hits and dysregulates the immune system and causes the havoc. If we kind of remove the insults, clean up the body, can we retrain the immune system to stop attacking? Yes, we see it all day long, right? So, sometimes
elimination diets would be a great example.
Absolutely, exactly, doing all that stuff, sealing the holes in the gut, as I always tease, cleaning up. So absolutely, I think it's hard to truly reset the immune system if you have not removed the insults. So for those patients, I think they may need it longer term because either they're not willing to do the right stuff to reset the immune system, or they're just so sick. Like, we've had these patients like with chronic Lyme and things. It is not a quick fix. Sometimes that's a 2 to 5 year process, right?
Ouch.
So, sometimes those people have, but they've had it for 20 years, right? And they were kind of diagnosed with everything else but, or other things. So yeah, the hard and scientific academic answer that I would give, obviously, as an academic person, is we don't have all the science to tell us, but I can tell you just from anecdotal data, if we remove a lot of the insults, can we help retrain the immune system? Yes. But if not, those patients may need, to be on this and many other tools probably long.
And we're glad to have you on the team. The next time we get you back on the Citizen Scientist Forum, let's take the discussion about immune integrity, which you are masterful with, and let's try to knit together kind of a real-world immune integrity dashboard for some of the citizen scientists out there.
Yeah, that would be good.
That's cool?
Amazing.
All right. Thanks so much.
Yeah.
Sahar Swidan, Pharmacy Solutions, and you can get on her Sahar World website.
Sahar.world.
Sahar.world.
And Pharmacy Solutions online.
And Pharmacy Solutions. Amazing skincare, lots of great education, and we'll get her back real soon. So thanks again, Sahar.
Thank you.